It's awesome.
If you got a card at the end, let me know.
I'll give it to you.
All right, let me know, yeah.
Also, how do you see it? It's definitely not. You were just going to say, no, we were pretty bad. I think the problem was we didn't, like, I was just on the right. Much better than the right.
Hello. Hi. Good afternoon. Thank you for being here. It is, I am Dr. Mara Divis. I am a family physician from Chicago, and I'm representing, I'm with Doctors for America. We are a nonpartisan, nonprofit movement of thousands of doctors and medical students around the nation across all specialties, representing all 50 states and every congressional district. And we've been working since 2009 to ensure that everyone has access to equitable, affordable, high-quality healthcare and the opportunity to lead a healthy life. We believe every person in America has a fundamental right to equitable, high-quality, and affordable healthcare. Everyone should have the opportunity to lead a healthy life. Every part of society should value and promote healthy families and communities. And doctors should take a leadership role in improving healthcare and ending health disparities. I'm a family physician. I am terrified of what repeal or severe scaling back of the Affordable Care Act might mean for our patients. My story is I finished training in Ohio in 2010 before the ACA was fully enacted, and a large proportion of the patients I saw in training were suffering from the ravages of uncontrolled diabetes, hypertension, untreated mental illness, the effects of past trauma or addiction, and were often in the end stages of disease. Their common denominator was being without insurance. They'd had no access to routine preventative care or screening that could have mitigated or prevented the effects of their chronic disease and prevented its progression, so they would end up in the ER again and again because they were suffering. As I entered practice in Chicago, in a state that expanded Medicaid, I began to see patients who had expanded Medicaid, and it was pretty much the best thing ever for them. It was unbelievable that people who'd worked hard their entire lives but could never qualify for insurance could suddenly turn to a medical home for screening, for care, for management of their illness. And also people who previously diagnosed with chronic illness who could now maybe follow an entrepreneurial spirit and start their own business or work in a non-traditional role, not being tied to employer-sponsored coverage. As Medicaid expanded further, I began to see fewer uninsured patients, more covered patients, and I had hoped that despite the ACA's flaws, it had us on the right track to fixing things, to fixing a more deeply flawed healthcare system, and I still do. But now I'm really worried because we have a Congress that has a majority party that's been slinging around a slogan for 7 years, has been defining the law by its fixable flaws rather than the good it's done, good that I see every single day at work, and a party that does not acknowledge this good that has come from decreasing the number of uninsured Americans. As of 2015, the percentage of the U.S. population with no insurance was down to 10.5%, the lowest it's been in decades. And being as someone who watched uninsured patients, I saw them wait longer to get screening tests. They're more likely to have advanced disease when they're diagnosed, more likely to be hospitalized, less likely to adhere to follow-up plans. So I see, and more likely to end up losing their home, their life savings, their dreams because of medical debt, which at one of its roots was one of the goals of the ACA. So I see every day how good this is. I worry that we have a U.S. House of Representatives that voted by a margin of 217 to 213 in May 4th, to pass the American Health Care Act, which if it were confirmed by the Senate, would have plainly taken health care away from 23 million Americans, including 416,000 Wisconsinites, eliminated the provision that insurance cover pre-existing conditions, dramatically increased premiums such that people, especially older Americans, would pay much more for much less. And fortunately, after the bill took on a few more lives in the Senate, after some backroom crafting, it very narrowly and dramatically escaped approval, fortunately. So we're here today because despite that this atrocious legislation has barely escaped approval, the stakes remain really high. Donald Trump is actively seeking to weaken key components of the ACA via executive order, weakening the individual mandate, imposing work requirements, failing to do any advertising or outreach. And this is sad, and this is unacceptable. And we're here because our legislators, our elected officials need to hear from us as doctors, as nurses, and more importantly as parents, as grandparents, sons, daughters, and friends, and most of all as patients. Every one of us either is or loves someone who is a patient. They need to know that this law has done us good. They need to know that any change that takes away health coverage is not good enough. Any law that allows our state to say that it won't enforce coverage of pre-existing conditions or cover maternity, newborn, mental health care, prescriptions, etc., 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 I could go on, is not good enough. We deserve better, and we will vote for better. We have some wonderful members of various communities here to talk about and share their stories, because it's our stories that will make a difference. I firmly believe that. First we have Pat Rago. She's a registered nurse to speak to us from the nursing community.
Thank you. What a gorgeous afternoon. I'm here to speak to you because of the health care also. And my name is Pat Rigo. I am a recent retired nurse from Sauk County. I've worked in the healthcare field close to 40 years, working med-surg, ICU, dialysis, orthopedics. The last 21 years I've worked with Sauk County and did home care, supervised personal care, orthopedics, dialysis, most recently working with the chronically mentally ill in the community. But I am here because I do care. But not only do I care, I'm greatly concerned about the future of our health care. Not only as a nurse am I here, but I'm a mother, a daughter, a friend. I'm here as a community person in your community, in my community. I personally believe that everybody has the right to health care. Passing the Affordable Care Act was the first step in that direction, giving more than 20 million Americans health care coverage. Therefore, reducing the rate of the uninsured in America by drastic standards, and it's the lowest it's been in history. The Affordable Care Act helps us in Sauk County plan and deliver the best care to the most people possible. The people I served are very dependent on the Affordable Care Act and Medicaid. This is life and death to them and others. Before the ACA, I took care of people in ICU for days because they didn't seek health care coverage sooner because they didn't have insurance. I had visited people in the homes, and this is where you get the picture of what's going on with their health care. Not taking their meds because they don't have health insurance, making poor choices in food, like pet food, because they're trying to pay medical bills. Now, do these things probably continue? I'm sure they do. But guess what? This is because we haven't done enough to make health care available to everybody. Since the ACA, I've also provided care to people that have signed up for the ACA. But they worry with the constant threats of repeal from our Congress. Will they have coverage? Will they be able to afford insurance? Republicans have had over 7 years in the process they're trying to repeal the health care. What have they been doing? When are they going to come up with a plan? Paul Ryan, Ron Johnson, and Donald Trump, you and the Republicans own health care. The American people do not want false hopes, and they certainly don't want to be tricked into plans that are made behind closed doors. Repealing or reducing health care would leave millions without medical coverage. This is not healthy for our country. We stand together, challenging the barriers on this journey to protect millions of Americans with health care. Thank you.
All right.
Thank you, Pat. Next, Merritt Singleton is here to give us a perspective as someone who's benefited from the ACA. Is she here? Yes. Here she comes.
Hi, my name is Merritt. I live just outside of Madison, Wisconsin with my husband. We have 3 young daughters that I stay home with, and we also own a small business that he operates. Before the small business, my husband was a rowing coach at the University of Wisconsin, and before that, he very proudly represented the United States as an athlete at the 1996 and the 2000 Olympics. And I mention that just to give you a sense of his level of general health and strength. Of course, that was 20 years ago, but even as of 2016, he was in the habit of running a half marathon in the summer and skiing the Birkie race in the winter, just to maintain his fitness. But last year, as he was sort of gearing up for the Birkie, he was finding that he was struggling to exercise in a way that wasn't normal for him. Other than this, he felt totally fine. There was no other indication that there was anything wrong, but this exercise intolerance, is it not loud? Okay. Yeah, it's a little, I'm kind of crouching. It ultimately led him to be diagnosed with a rare inflammatory disease that we had never heard of that was slowly stopping his heart. So his treatment for this was swift. It was aggressive. It is still ongoing, and it's pretty complicated. His prognosis is good, but this is a lifetime disease, and so even under the best of circumstances, he will require several procedures throughout his life. He'll be on some level of drug therapy, probably for the rest of his life. And he'll need several scans or tests every year just to monitor the disease so we can treat it when necessary. So any healthcare system that wouldn't protect access to affordable care for people with pre-existing conditions, any healthcare system that allowed insurers to put caps or limits on benefits or services received in a lifetime would price us out of being able to afford his care on our own. And thinking back to last year, to 2016, when this all happened for us, it was a really difficult year for my family. We worried a lot about like the big things, but one of the things that we never worried about was whether or not we were going to be able to get him the care that he needed, which in the face of a life-threatening illness was a tremendous gift. And hearing the discussions that are going on now, and the tagline of "this system is broken, this system doesn't work," it's a little bit frustrating to hear that because, of course, the system isn't perfect and probably needs a lot of work. But for my family, it did work, and for my family, it's still working. So that's it.
Thank you, Merritt. Next is Molly Moran, who will give us another perspective of someone who has benefited from the ACA.
Hi, my name is Molly Moran, and I wanted to share my healthcare story because I think it will resonate with people regardless of how you vote and regardless of your party affiliation. So about 2 years ago, I had what to the outside eye looked like a really great job. I worked for a software company. It paid very well. It was fairly interesting work. And to top it all off, I had arguably the best healthcare in the world. And so I was able to provide healthcare for me and my husband and our young daughter. The only problem is that I hated my job. Sorry, I'm a little nervous. Yeah, I didn't find it to be fulfilling. And I've known since college that I wanted to open my own business. I had that entrepreneurial spirit that we all talk about. And I wanted to at least give it a shot. And I knew that I wouldn't be able to look myself in the mirror and say like, yeah, you're living life to the fullest. Or if I didn't actually leave this job and do something else. I'm always telling my daughter to be brave and forge her own path, and I knew that I was kind of just paying it lip service, and I wasn't actually living the life that I was talking to her about. So I decided to jump off that cliff. I decided to start my own business. And one of the things that we thought about that my family had to weigh considerably is what were we going to do about healthcare? My husband has a great, awesome job that, like a lot of jobs, has been structured so that he doesn't have benefits. So here we are thinking that we're going to give up all that people dream about to open our own business, and we had the ACA. So we had the safety net there, and we were able to do it. So of all of the decisions that we had to weigh, all of the drawbacks and benefits of opening our own business, that was one thing we didn't have to worry about, is that we knew we could still go to the doctor if we got sick. And what we've seen over time is that we've created this community space where I know that people in my city, I watch their faces light up when they come inside. I know I'm making their lives happier and better, and I know that I'm living the life that I want to live. Because of that safety net. That is not to say that it couldn't be stronger. That is not to say that it couldn't be better and give people more support. But I do think that if people are going to preach about living the American dream, being job creators and being bold, you have to give people the safety net that they need to be able to take those risks. Thank you.
Wonderful. I love hearing these stories of how people how having this safety net helps people to live their dreams and to feel secure in living those dreams and not fear. Next on our agenda is State Representative Deborah Kolsty. She is a local from Janesville.
Thank you, everyone, for being here. Thank you, Drive for Our Lives, for being in my district and being here to show Paul Ryan that healthcare voters do care about what's going on. I've been in medicine a lot of years, actually a lot of years. And this is the most concerning I have seen in the public. We need changes. This is what a community of citizens should look like. People that are caring about everyone in their community. I mean, I think you're the real patriots because you're the individuals concerned about the welfare and well-being of everybody, the citizens and the people that make up your country. I was reading the Wall Street Journal today, and Dr. Lilla stated in the Wall Street Journal that Franklin Roosevelt pictured a place where citizens were joined in a collective enterprise to build a strong nation and protect each other. I will add that he didn't mean just from aggressions from other countries, but protecting people from contributing to the strife of their lives and the stress of not having health care. I think our first protection should be to our citizens is their well-being. Dr. Willie also said that Roosevelt's vision included solidarity, opportunity for all, and a public duty. I think that public duty of our citizens and of our government should be to provide health care for its people. Public duty is about protecting people who can't, and it can't be accomplished by increasing the cost and making it harder to get health care. And if we repeal the ACA, that's just what happens. It makes it harder for people to get health care. In Wisconsin, what the ACA did for us, it allowed 211,000 more people to have health care. It allowed millions of people not to have to worry about pre-existing conditions or lifetime expenses. It allowed people to have preventative health care at no extra cost. And that is really, in the long run, which is what is going to drive down the cost of health care. But one of the most important things it did, that it allowed for mental health and substance abuse health care to be called just that, health care. It is, we now change to the definitive notion that mental health and substance abuse are just health care. Some of you attest here, I am not always the most vociferous partisan politician, but on health care, I am willing to shout that people deserve better. To my Republican counterparts, I say, it is time to take care of our neighbors, to take the United States healthcare to the level of the majority of the developed world. We need better outcomes at lower cost. Right now, what we have is the most expensive healthcare with some of the worst outcomes in the world. More costly and worse outcome, it is time to permanently take care of our health care and to take care of each other. On a personal note, everyone is giving stories, and some of you here know this story. My sister was diagnosed with stage 4 ovarian cancer 2 months before the ACA came out. She was able to get it. She had a full-time job, but they didn't provide health insurance. Her husband had ulcerative colitis, so he was on the high-risk insurance pool. So they were paying over $1,000 a month between two premiums, and their deductibles and copays were in around $15,000. She was able to immediately in January get on the ACA. It was a godsend. 2 or 3 months ago, she was re-diagnosed, and her first thought was, I don't know what to do now. Maybe I won't even seek treatment. I don't know what's going to happen to insurance health care. I say it is time for us to step up and take care and fix health care. Thank you.
Thank you, Representative Kolste, for your moving words. State Representative Jimmy Anderson now will speak, representing the Dane County.
Hi everyone, thank you all for being here today. I want to share my story, and hopefully by the end you understand why it is that I think that you all are heroes. You know, it was back in 2010, and I was visiting my family for starting school. And it was a couple days before my birthday, and we wanted to go out to celebrate. We were on the road for only a few minutes before a drunk driver ran a stop sign and sideswiped us at about 60 miles an hour. I don't remember much, but I remember the car tumbling and coming to a stop, and I remember hearing the ticking of an engine, and I was a little disoriented, and I wanted to reach out and see if my family was okay, and I couldn't move, and I didn't understand what was going on, and I started to yell for them. I said, "Andrew, my little brother, tell me you're okay." And there was just silence. I said, "Mom, tell me you're okay." More silence. Dad, can you hear me?" There was nothing. And I knew at that moment that they were gone. Now, it took a little bit longer for me to eventually pass out from blood loss, but I woke up in a hospital, and my wife was sitting alongside me. Sorry. And she told me that I lost my mom, my dad, my little brother, and I was paralyzed from the chest down. Now, it wasn't long after that, after doctors did their best to patch me back up, they got a letter from my health insurance company saying that you're nearing your lifetime maximums and we're going to have to kick you off. It was such a shock. My wife and I were just students at the time. We paid our premiums, we played by the rules, but still, we were about to lose everything because a drunk driver decided to go driving that night. It was honestly, we didn't know what we were going to do. And so it was 3 days later that we got another letter saying that the provisions of the Affordable Care Act have just kicked in to get rid of those lifetime maximums. I can honestly say that the ACA saved my life. And so I wasn't very political up to that point, but I realized that these kinds of good policies don't happen by accident. They happen because of people like you. And so to me, all the work that you did to make the Affordable Care Act a reality, you're my heroes. You guys saved my life. And so I realized that I needed to also participate, that I needed to give a damn. And so I'm here today paying it forward and hopefully making sure that we don't take those steps back, where we don't lose what we have now, that we continue to build, that we continue to save lives. But again, thank you for being heroes. Thank you so much.
Thank you so much, Representative Anderson. That reminds me, I fight because I know that we are all one moment away from needing coverage, from needing lifetime coverage. We are all one accident, one diagnosis away from a pre-existing condition. And it's the reality. It is not for only the least fortunate amongst us that I continue to fight. It is for every single one of us, because every single one of us needs health care. Every single one of us will benefit, has benefited, and will continue to benefit from the Affordable Care Act. That is why I continue to fight. Thank you all so much for being here. It is because you believe in this fight, that you believe in equitable health care for America, that you are here, and it gladdens me and continues to make me feel like this is a fight very much worth fighting. We have a call to action now that we would like to end with. We hope that this event is a call to action for all constituents to make their voices heard on the fight for healthcare, the continued fight. By sharing your personal story, you help bring this fight to life and inspire others to do the same. To that end, we encourage you to incorporate these calls to action into your remarks. There's a text messaging campaign. There is a Drive for Lives, Share Your Story. Over here. I invite you to head over there to craft some remarks into text messages. Protecting healthcare will be a long, important fight. We need your help. Pull out your cell phones. Everyone's got a smartphone. Hold them up. Everyone hold up your phone. Text Our Lives, one word, to 52886. 52886. That's text Our Lives, all one word. Now, you'll get information to fight back at the next threat to our health care, which we know President Trump and Republicans in Congress will continue to plot. So there's that. Number 2 is a Storyvine story submission over here, the text messaging I talked about. Once our program's over, head over there to the big sign that says Share Your Story. Talk to a member of the Save My Care team. They're collecting stories from across the country to share with members of Congress and across our social media channels to let folks put a face on who's really at stake, all of us, all of you. Lastly, there's a healthcare voter pledge. The GOP voted time and time again to strip away healthcare for tens of millions of Americans. 217 Republicans in the House and 49 Republicans in the Senate voted to cut our care. We will hold them accountable for their votes every single day. Sign up today and show that you are a healthcare voter. Thank you.